single-dose Johnson & Johnson vaccine and vaccination site finder was launched by the National Primary Healthcare Development Agency in collaboration with Federal Ministry of Health with the theme One Shot COVID-19 Vaccine for Everyone. Keynote speaker, Honorable Minister of Health, Dr. Osage said, Scale 2.0 strategy, the Johnson & Johnson rollout and the immunization site finder are great opportunities for Nigerians to wrap up COVID-19 vaccine coverage and reinvigorate routine immunization uptake.
In November 2021, NPHCDA introduced the SCALES strategy to rapidly ramp up the COVID-19 vaccine coverage by expanding access to vaccines outside health facilities. Now, at this point, let me say that if we had had enough health facilities, if, for example, we had the network of functional primary healthcare centers, nearly 10,000 of them, all over the country, they will have been very ideal platforms for delivery of these vaccines, because people who live in those areas will know the health workers there, you will know the community health extension workers, you will know the nurses, they will be familiar, they have given you injections before, they've given you immunization, they've given you tablets, they treated malaria, and if they came with a new vaccine, you will accept it much more easily than if someone like me spoke. They would probably not listen to me. So again, the question of the mass of activating the primary healthcare center is something dear to us, and we want our development partners to share this desire with us. So we ramped up this coverage by expanding the access outside health facilities, and mass vaccination sites were established at public places such as markets, parks, shopping malls, schools, mosques, and churches. SCALES is an acronym for Service Delivery, Communication, Accountability, Logistics, Electronic Report, Supportive Supervision, as we have heard from Dr. Basi Okbosen. Although the strategy has proven to be effective in ramping up vaccination coverage, the proportion of fully vaccinated persons is still low, partly because we have been using 2 doses, and people who take 1 dose and have a slight feeling of being unwell will not come back for the second, because everybody is apprehensive about this new vaccine, or maybe because it's too far away, or maybe because they are nomadic or itinerant workers who missed the second opportunity. So we expect to have some challenge with that, and that's why the single vaccine launch today is particularly significant, because you have one go at those who you may not see for a second chance. Of course, we are not talking about the booster dose for the Johnson & Johnson vaccine also, and but we still have the challenge of 2 being better than challenge of giving 3 shots. Unfortunately, most people will be reluctant to take their second dose, but we shall get over that with the Johnson & Johnson vaccine. We continue to strive to make COVID-19 vaccination more accessible to the people. I'm pleased that most Nigerians can now be guided to the nearest COVID-19 vaccination site from the comfort of their homes and from their phones. Again, we must not forget that although we have a mobile penetration of 80%, not many people have a smartphone, and not many will have the savviness to navigate what was described to us just now. But again, if we encourage children and grandchildren to get involved, particularly for the older ones, it might become a family practice. Now, we have a unique opportunity to leverage on the scale strategy using COVID-19 vaccination structures and resources, and to also improve routine immunization coverage with improved efficiency and reduced duplication of efforts by healthcare workers. So combining these scales and routine immunization will bring benefits mutually. Now, this will ensure that while controlling transmission of COVID-19, Nigeria does not become a fertile ground for the outbreak of childhood vaccine-preventable diseases, so that we can rapidly increase, in this way, routine immunization uptake along with COVID-19 uptake. It is imperative that we now launch this Scales 2 strategy, which entails the integration of COVID-19 vaccination with routine immunization for eligible adults and for children 0 to 3 years respectively, leveraging on the mass vaccination campaigns, routine immunization fixed sessions, outreach services, and mobile services. We are also formally rolling out, as I said earlier, the Johnson & Johnson single-dose vaccine and introducing this very important COVID-19 vaccination site finder. All childhood vaccination, including administration of vitamin A, will now be done together with COVID-19 vaccination at COVID-19 vaccination sites. Eligible children will now be able to receive their BCG, the Penta 3, OPV 3, OPV 1 and 2, measles, yellow fever vaccines, as well as vitamin A supplements at sites where the adults receive their COVID-19 vaccines. This is the good news that we are bringing to Nigeria today. I wish to assure everyone that we have enough stock of the vaccine, well over 30 billion doses, in fact, over 40 million doses, I can confirm, of Johnson & Johnson vaccines, not counting the offer of donations that we have waiting. So I call on all eligible persons who have not yet received their vaccination to now go to the vaccination site using the app that we were just shown. The single dose offers the same protection to you, which you get from the double dose of BioNTech, Pfizer, or Moderna, or AstraZeneca. I also encourage those who have received the first dose of AstraZeneca, Moderna, Pfizer, don't bother about yourself about the mild symptoms you may have had, because that is very little compared to the protection you will get from the second dose. So I do encourage you, even if you have felt pain at vaccination site, or you had a slight fever, a slight headache, to still go for your second dose, because the benefit is far more than that discomfort, to get broader and wider protection. Now, the Scales 2.0 strategy and the J&J rollout and vaccination site finder are great opportunities for Nigeria to now ramp up COVID-19 vaccine coverage and to reinvigorate the routine immunization uptake. The federal government has provided Nigerians with the opportunity to provide themselves, to protect themselves at no cost. You also protect your loved ones against COVID-19, all at no cost. You do not need to pay anything. So we can enjoy the ease of access to childhood immunization and also to the COVID-19 immunization.
Amina Ibrahim, GTV Africa.